One of the more common types of anxiety which a child can experience is separation anxiety. Separation anxiety is really tricky for the child and also for their family. What it can look like is separation anxiety is an intense fear of separating from a primary caregiver. So what that means is it can make things like going to school, going to daycare really, really tricky for a child. So what you might see is your child becoming very distressed at times when you need to leave them. So what that can look like is crying, tantrums. It can also be things like a child saying, I've got a sore tummy, I've got a headache, I'm too sick to go to school. Because of the anxiety, they're experiencing physical symptoms as well. So there's a few different factors which can increase the likelihood of a child developing separation anxiety. So these can be genetic disposition to anxiety, can also be if a child is going through a significant life change or adjustment. So for instance, moving countries or moving to a new school. Then we've also got factors like temperament. So some children are more likely to be anxious than other children based on their personality and the way that they look and understand the world. So I think preparation is the key. Of course, it depends on the age of the child, but age-appropriate preparation. So they understand this is where you go to school now, this is what it looks like, this is your teacher, this is the time that mum or dad is going to pick you up from school. So to make it all a bit clearer to them so it's less frightening, it makes more sense. And then I think the other thing is being mindful of what a challenge and how brave these little people have to be when they first start going somewhere new. And so really just making sure that they've got extra time, extra attention, extra love from their favourite people, which is normally mum and dad, just to really build them up and support them when they're going through the challenge of adjusting to being somewhere new. Living with separation anxiety can be really, really tricky, not just for the child, but also for their parents. But there are things you can do which make it a little bit easier for everybody. Probably most importantly, having consistent routines for your child, particularly, let's say in the morning, in the lead up to them attending school and separating from you. So you want your routine to be consistent and predictable so your child knows what to expect at the start of every day. And then you also want to make sure that you have a routine around saying goodbye so that it's gentle and it's kind to your child, but also firm and also reassuring and reminding them that they're brave and that they can do this. And then you've got other little tricks which you can do as a family. So things like practicing mindfulness. So we know mindfulness is helpful in reducing anxiety levels. And we can do deep breathing, progressive muscle relaxation. So other skills which really teach your child how to relax and how to calm down. When you can really see your child is a little bit stuck in the pattern of struggling to separate and their distress is quite high, I also think their distress often has a flow-on effect to the family unit and it becomes really difficult for everybody to cope and to get by. So if a child is incredibly distressed, cannot be calmed down, and that distress is happening each and every drop-off and it's happening for a week or two, at that point it's very appropriate to reach out and to get some extra support. If your child is struggling to separate when they're attending school, give them a couple of days, and with some extra kind of care and love, it may become easier for them as they adjust and as they adapt to the new setting. So the most helpful therapy approaches for separation anxiety, CBT or cognitive behavioural therapy, where you teach a child how to manage the anxious feelings with the support of their parent and working on building up helpful thinking and behaviours. And we do this in a very age-appropriate way for a child. What also happens as a part of CBT typically is exposure therapy. So what that looks like is your child, in a supported way, is exposed or practices separating from their parent. And this is done very gradually and increased over time. So as your child feels more and more comfortable, they practice separating from their parent. And when they have success at each stage, it allows them to feel a bit more confident and braver and ready then to take the next step away from mum or dad. So if a child is incredibly distressed, cannot be calmed down, and that distress is happening each and every drop off and it's happening for a week or two, at that point it's very appropriate to reach out and to get some extra support.